This is an overview of an article entitled Impact of Pathogenic FBN1 Variant Types on the Progression of Aortic Disease in Patients with Marfan Syndrome, published in the June 2018 issue of Circulation, Genomic and Precision Medicine. Marfan Syndrome, or MFS, is an autosomal dominant heritable disorder of the connective tissue that affects the cardiovascular, skeletal, ocular, and pulmonary systems. Recent surgical treatments for patients with ascending aortic aneurysms have improved their life expectancy from around 30 years to over 70 years. Surgical replacement of the aorta is recommended when the aortic diameter is greater than or equal to 45 to 50 millimeters. However, it remains difficult to precisely predict when and how fast their aneurysms grow to a size at which surgery is indicated or rupture occurs. This results in substantial anxiety for MFS patients. Up to 97% of MFS patients who fulfilled the revised Ghent criteria have pathogenic variants in the FBN1 gene, which encodes a major component of the extracellular matrix microfibril, namely fibrillin-1. This protein contributes to the integrity of connective tissues. More than 3,000 pathogenic variants, which are mostly unique among families, have been identified in the FBN1 gene. The penetrance of pathogenic FBN1 variants for MFS is generally high, but phenotype prediction from different types of FBN1 variants has been a challenging task. Recent studies have suggested that certain types of variants are associated with more severe aortic phenotypes. In the paper under discussion, the goal was to better define which types of FBN1 variants result in increased progression of aortic disease. The authors enrolled 248 patients from 202 Japanese families who had pathogenic or likely pathogenic FBN1 variants. More than 90% of these patients fulfilled the revised Ghent criteria for MFS. Haploinsufficient, or HI, variants were defined as nonsense, frameshift, out-of-frame exon skipping, and initiation codon variants. Dominant negative, or DN, variants were defined as missense, in-frame indel, and in-frame exon skipping variants. For the purpose of this study, serious aortic events were defined as aortic root replacement, type A dissections, and aorta-related death. The other major phenotype studied was progression of aortic root dilatation. When stratified into subgroups by type of FBN1 variant and sex, multivariable analyses showed that having HI variants rather than DN variants increased risk 2.1-fold, whereas being male rather than female increased risk 2.4-fold. The authors sought to define a subgroup within the DN variant carriers who had higher risk of aortic events. Among the 7 DN variant carriers who had severe aortic events at less than 20 years of age, in other words, an unusually severe presentation, 6 had variants affecting conserved cysteine residues within the calcium-binding epidermal growth factor, or CBEGF, domains. Accordingly, the authors defined any such variants as DN-CD variants. When the authors stratified the entire cohort by FBN1 variant type, now with 3 categories, HI, DN-CD, and DN non-CD, they found in multivariable analyses that DN-CD variant carriers has 6-fold increased risk compared to DN non-CD variant carriers. HI variant carriers had 3-fold increased risk compared to DN non-CD variant carriers, and they appeared to have similar or possibly decreased risk compared to DN-CD variant carriers. The authors assessed aortic root size in 2 different age groups, those under 20 years and those between 20 and 40 years. In each age group, they found that the combined subgroups of patients with HI or DNCD variants had substantially higher aortic root sizes than the patients with DN non-CD variants. Finally, the authors assessed the effect of sex on aortic root growth in patients less than 20 years of age. As can be seen in the left panels, male patients had greater increases in aortic root diameter than female patients. The right panels show that male patients were, over time, likely to have increased aortic z-scores, a measure that adjusts for body surface area, in determining whether there is aortic root dilatation, whereas female patients were not. In summary, the authors found in a cohort of Japanese MFS patients that HI variant carriers had a higher risk of aortic events compared with DN variant carriers, that DN-CD variant carriers had substantially higher risk than DN non-CD variant carriers, comparable to risk of HI variant carriers, that aortic root size was greater in patients with DN-CD or HI variants, and that male patients had higher risk than female patients of aortic events, as well as being more likely to have progression of aortic root growth, consistent with previously published observations.